Right. Hello. Good afternoon. My name is Jessie Antonucci. I am the Community Assistance Division Director for the Jefferson County Department of Human Services. So what we do in the Community Assistance Division is we oversee the administration of public benefits like SNAP benefits, TANF benefits, and adult financial, as well as medical assistance benefits like Medicaid. And we also do child support in CAD. So today we're going to talk a little bit about the HR1 changes for SNAP and Medicaid. Before we jump into that, though, there are a couple of big things going on right now. We have the changes for HR1 or the One Big Beautiful Bill Act for SNAP and Medicaid benefits. But we also have a government shutdown situation where SNAP benefits are currently on hold. So this is coming to you today on the 10th of November at about 4 p.m. And I say that because things are changing so rapidly and so fast when it comes to SNAP benefits. Over the last few days in particular, news has been rapidly changing regarding families having access to food through their SNAP benefits. So as we know right now, and this message could potentially change by the time that you see this recording, on Friday evening, the Supreme Court granted the Trump administration's emergency appeal to temporarily block a court order to fully fund SNAP aid payments during the government shutdown. So even though residents in some states already received the funds, so that is what happened in Colorado over this weekend, but only 32,000 out of the 600,000 households that receive SNAP benefits were able to receive full benefits once the U.S. Supreme Court issued a ruling that pauses distribution of the benefits. So we're not certain of how many of these 32,000 that receive benefits were Jefferson County residents. But we did want to let you know that all payments that were loaded onto EBT cards prior to this court order are available, and you can use those benefits now if you need them to purchase food. Additionally, this last Saturday on November 8th, Jefferson County issued an order declaring an emergency disaster in response to the ongoing delay in SNAP benefits. So this is because it poses significant and lasting health and economic impacts when these benefits don't go to the families that need them and don't go to the grocery stores that support them. Here on this slide as well, sorry, Brandy, if you go back, these are hyperlinks, but these are some sources that you can go to if you need some supports for food benefits while SNAP benefits are on hold due to the shutdown. Sorry, and now you can go to the next slide. So while we have the shutdown going on right now, what we really wanted to talk about, because this is happening at the exact same time, are the changes for SNAP and Medicaid benefits through the HR1 bill. So this is the budget reconciliation bill at the federal level, and this is also known as the One Big Beautiful Bill Act. This was signed into law on July 4th. So the changes for SNAP and Medicaid are sort of staggered over the next couple of years, but there are changes that have already happened as of November 1st. So we wanted to make sure that we were getting out to the community to let you guys all know what some of those changes were. So starting a little bit about SNAP. So this is a program that provides benefits to help people afford nutritious food essential to their well-being. In Jefferson County, we have a little over 38,000 people on SNAP benefits. And on average, we issue about $7.6 million each month in food assistance benefits. Most people receive about on average $337 a month. So if you go to the next slide, please. Jumping right into the changes that came through with HR1 or the One Big Beautiful Bill Act, The first one that happened as of November 1st are the changes to the SNAP work requirement rules. Uh, you might also hear this referred to as ABOD rules. ABOD is an acronym that stands for Able-Bodied Adults Without Dependents. Although we already had ABOD rules or work requirement rules in place, they have changed and they have been modified over the years. As an example, during COVID, we had waivers in place that exempted our whole SNAP population from needing to adhere to work requirements. With HR 1, there are enhanced work requirements, and those impacted are going to be people that are ages 18 to 64 who do not have young kids. They may need to work or be in a work program to receive SNAP benefits. So this is enhanced because that top age range used to be age 54, and now it goes to age 64. In addition, for our old ABOD rules, you would only be subject to work requirements if you had kids in your house that were 18 and younger. And now anyone whose youngest child is 14 years old may be subject to those work requirements. So additionally, well, there are some reasons that you would not have to adhere to work requirements for SNAP. We are also losing some exemptions or reasons why you would not have to meet work requirements through the HR 1 bill. So these exemptions include veterans, people who are unhoused, and people who were in former foster care. In Jefferson County, we have about 1,100 people that will lose their exemption status and could be required to follow the new work requirements if they do not meet any other exemption. So now that we talked a little bit about the rules that are changing, this is a little bit more information about what this could mean for you if you are subject to the new work requirement rules. With all of these, it's really important that you talk to an eligibility specialist here in Jefferson County to see if you meet any of the current exemptions or reasons why you would not have to adhere to work requirement rules. So this could be during your interview for SNAP benefits, or if you call us on the phone to report a change as well. So if you're subject to meet work requirements for SNAP, you're required to document at least 80 hours of work, education, or volunteering each month to receive SNAP benefits. So this equals about 20 hours a week. If those requirements are not met and you have an open SNAP case, your benefits will be closed after 3 months unless you, as a SNAP recipient, would qualify for an exemption or start meeting those work requirements and working that 80 hours a month or volunteering the 80 hours a month. Some of those exemptions that are still in SNAP rules after the HR 1 changes include pregnant, those who are disabled, caregivers, and those that are unfit for work. And if you go to the next slide, please. Wanted to talk a little bit about what the impacts are and what this means for Jefferson County. So as we talked about, we have about 1,100 people through our unhoused population, veteran population, and former foster care. In addition to those folks that are going to be losing their current exemptions for work requirements under the new rules, we're also adding a significant number of customers through the changes to the age requirements. Specifically, we're adding almost 2,500 people that are between the ages of 55 and 64, and another 2,000 people whose youngest child is between 14 and 18 years old. So overall, this is going to increase our current SNAP population that is subject to the work requirements by 147%, which is very, very impactful to our communities. So if you're active on SNAP benefits right now, and you're part of this change and you're subject to these work requirements, this will happen when you recertify for benefits or when you're applying for benefits. So it's not something that just happens overnight for everyone that's on SNAP, if that makes sense. Another change through HR 1 is changes to the heating and cooling utility allowances. So once you qualify for SNAP benefits, some of the things that you pay for can help to increase the amount of SNAP benefits that you receive every month. Utility costs are one of those things. So prior to HR 1, all SNAP households were granted the largest deduction for utilities that you can receive. And this made everyone's SNAP benefits go up a little bit. For the SNAP recipients that are not responsible to pay for heating and or cooling expenses, there were two other ways to receive this deduction. So one of those is through a program called EBT, and another one is through receiving LEAP benefits or the Low Energy Assistance Program. So new rules for utility allowances will only allow this higher heating and cooling allowance for households that have an elderly or disabled person, or if that household is responsible to pay heating and or cooling costs. So if you're not responsible to pay heating or cooling, and you do not have someone that is elderly and disabled or disabled in your home, you could see your benefit decrease as you would only be allowed to receive the deduction for the utility costs that you're responsible to pay. So this could mean, as an example, that if your heating and cooling costs are included as part of your rent expense and you're not responsible to directly pay those, your SNAP benefits could decrease. Our state partners at CDHS has indicated that this could impact up to 13,000 people in Jefferson County. And on average, your SNAP benefits could drop about $95 a month on average. This also is a change that would happen when you recertify your benefits or when you apply for new benefits. Another change to SNAP that happened through HR 1 changes on November 1st is that many immigrants who used to qualify for SNAP because they were here for humanitarian reasons will no longer be eligible to receive SNAP benefits. This rule change impacts about 1,000 people statewide, or 170 people in Jefferson County alone that are on SNAP benefits right now. If you're currently on SNAP benefits, this is also a rule that will take effect when you recertify for benefits. These are some of the statuses that we have received federal clarification on that will no longer be eligible to receive SNAP benefits, including the refugee populations, asylee populations, those that are parolees, certain Afghan nationals, certain Ukrainian nationals, and those who have a status of deportation withheld. So those are the major policy changes for SNAP benefits that will impact our community directly when it comes to policy changes. And we're going to talk a little bit more about the Medicaid changes. So if you did not know, Medicaid is a joint federal and state program that provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. There is currently a little over 81,000 people that are on Medicaid benefits in Jefferson County. This is about 1 in every 4 people who live here in Jeffco. Well, the SNAP changes that I just discussed are happening now. We have a little bit more time to implement some of the Medicaid changes that we're going to be required to make through HR 1. In fact, we have not yet received formal guidance from our state and federal partners on how this will look just yet. So please expect some more information to come as we are still awaiting final rules. But I do want to talk to you a little bit about what we do know about the changes for Medicaid benefits. So, going kind of back to when the Affordable Care Act was enacted into rule in 2010, ACA allowed for adults under 138% of the federal poverty limit to receive health insurance. So, prior to this, Medicaid coverage was really only available to some parents that have very low income, kids, and those that are disabled. And then with the Affordable Care Act coming in 2010, we created what is called Medicaid expansion. So that's all the new people that are now eligible to receive Medicaid benefits under that Affordable Care Act. So as of right now, this is almost 28,000 people in Jefferson County and about 377,000 people across the state of Colorado. It's important that we start here because many of the changes for Medicaid are going to be very specific to this population of people. So starting with updates to the work requirements or new work requirements for Medicaid, also referred to as the work, school, or community rule. Certain adults might have to prove they're working in order to keep their Medicaid benefits. Additionally, missing reporting deadlines could cause a loss of coverage. Specifically, adults that are considered able-bodied ages 19 to 64 must do 80 hours of work, school or training, community service, and they must show proof of this before getting Medicaid or when they're keeping Medicaid through the recertification process. These changes are starting in January of 2027. So this screen goes over the exemption of people that will not have to meet work requirements for Medicaid. So this includes people that are pregnant, parents with kids age 13 or younger, parents of kids with disabilities, disabled veterans, medically frail adults, people meeting this TANF or SNAP work rules, as well as Medicare recipients. I want to pause here just for a little bit. So you see some of the exemptions on this screen sort of align with SNAP. They're a little bit different in the ages and some of those things. But SNAP is different, and I just wanted to highlight that. So for SNAP benefits, if you're considered an able-bodied adult that needs to meet the work requirement, you will be approved for SNAP, and then you can receive up to 3 months of SNAP benefits without needing to meet those work requirements. This is on one of the slides that we went over previously. Medicaid is going to look different. So what we know through the HR1 changes is that if you apply for Medicaid today, you will be required to have met the work requirements for the 80 hours that I just discussed the month before your application. So if you apply today, we're going to be looking at the work hours that you did for last month. This is much different than SNAP, like I mentioned. So for Medicaid, with the changes, unfortunately, if you are not meeting the work requirements rule, or if you don't meet one of the exemptions that are on this screen, you could be denied for Medicaid benefits. If you please, yes, thank you. So here are some other big things that we're kind of faced with when we're looking at Medicaid changes through HR1. So a lot of the expansion population that I mentioned earlier will start having to turn in a redetermination or an RRR every 6 months instead of every year that is currently happening right now. So this is just a lot of chances to, discontinue because of not providing paperwork or some other type of procedural reason. So when we look at more frequent eligibility checks and you are one of those folks, always keep an eye on when your redetermination is due to try to avoid any lapse in coverages. It's also important to mention that at the county, in Jefferson County, this will increase the amount of work that we need to do. So just know that behind the scenes, we're working as hard as we can, as fast as we can, just to make sure that people do not fall off of benefits and they're getting the coverage that they're entitled to receive. Another big shift that came with HR1 has to do with requiring a copay for Medicaid recipients. So this could be from $1 to $35. It depends on the different types of services. But when you go in to see a doctor, the changes will require that you pay some kind of copay to get care. And this is going to start in October of 2028. Another, or the last big one to mention rather, has to do with retroactive coverage. So retroactive coverage basically means that if I were to apply for Medicaid benefits today, I could go back 3 months from my application date. This is very helpful for people that were in a hospital or they had some sort of emergency happen that means they need their coverage backdated. But under HR1 changes, that 3 months is going to go down from 3 months to 1 month. And this is going to start in January of 2027. There will also be changes for immigrant populations through HR1 for Medicaid. And this one is starting sooner than some of the other ones for Medicaid. This happens starting October 2026. So some lawful immigrants, about 7,000 people statewide, will lose coverage, including our refugees, our asylees, and our parolees, sort of like SNAP, but this is one we are still waiting federal clarification so that we know a little bit more about what those rule changes will be. And finally, just wanted to have a slide to kind of wrap us all up on things that you can do to make sure that you're staying covered for benefits if you're eligible for those benefits. So the first thing that I'd really like to emphasize is to just keep applying and keep renewing your benefits on time. You may still qualify for help. So we see that there's changes and some of this is big and they're big changes, but please continue to apply so that we can see if you're eligible to receive benefits. Ask us about other community resources. So we have a number of lists available. We can connect you to different things out there in the community. So different things for food and housing and health programs if your benefits do change. While we are still standing up some of these things, the Jefferson County Business and Workforce Center is available, and they're willing to jump in and help with making sure that people do not fall off of their benefits due to these changes for HR1. So they can provide help with job searches, training programs, work experience, and placement. And we're also looking at different ways or volunteering activities that we can help to connect our community to as well. So the next slide is really just the last slide, and I know we have a few people in the room here and this is being recorded, but are there any questions in the room? Yes, Sarah.
That was so helpful. Thank you, Jessica. I'm wondering if there's more detail on how people, what sort of records they need to keep or how they document or report the work volunteering or education requirement, particularly the volunteering. I think that would be one that would be a little harder to prove.
That's a great question. So you're right. Sometimes volunteering can be harder to prove, right? We can take a letter from the person that you're volunteering with or the organization. We will have some forms available that you can report this information. We can always help by calling that person that you're volunteering with so that we can verify that information for you as well.
Okay, great. Thank you.
Any other questions? All right. I want to thank you all so much for taking the time to hear this message. And we're here to help you in Jefferson County as you have questions and in whatever way that we can get you connected to benefits and services that you need.
Thank you so much. I'm going to stop the recording and we can regroup here.